What good is acupuncture? Well, acupuncture is good for a lot of things. The health concern or health issue most people understand that acupuncture can work for is pain. Pain's obvious. Pain's in our brain. It prevents us from doing things. Can't enjoy life like we want to. I wanted to go hiking. I can't go because my back hurts too much or whatever it is. Yes, it helps with that. That's the obvious thing it helps with. The other part of our health that acupuncture is phenomenal at treating is internal health issues, digestion, cardiology, pulmonary, endocrine system, fertility, you name it, it works on all of it. And the way it works is when we insert a needle and it's to a specific point, it doesn't have to be right into where the kidney is located or anything like that. It could be in other areas because our body's wired, and it is wired with nerves as a nervous system, blood flow system, fascia and muscles. What we do is
we recalibrate those things.
when we insert the needle, a couple things happen. We decrease inflammation, we decrease pain, and we increase blood flow to those areas. And that's the key, the microvessel blood flow. When we increase the blood flow to those areas, new nutrients come in and the cells are able to heal themselves. They're able to reproduce and create new cells because our body is reproducing cells all the time. Right now, your body is dying, your cells are dying and being reproduced. Every 11 years, our whole body is a whole new copy, down to the scar tissue and the bones, the eyelids, everything. When our mechanisms in our system forget how to do that for whatever reason, maybe it's the way you're eating, maybe it's genetic, maybe it's a traumatic injury, maybe it's psychological or emotional, the cells forget how to reproduce in those areas. So the injuries happen. So we can have the liver can start to not work as well, the kidneys, the digestive system, the heart, the brain even. Acupuncture works really well at getting blood flow into the body and stabilizing those areas so they're more balanced. The homeostasis occurs. When you're imbalanced, that's the body's not in ease. It's not balanced. It's diseased, otherwise diseased. And so what we're trying to do is rebalance your system so that you feel good again. What are some of the stereotypes or misconceptions people have about acupuncture that just aren't true? That I'm gonna have hundreds of needles in. Everybody's seen the movies and they're funny, but it's just not true. we use a very limited, very specific needles for your situation. Some people get more, some people get less, but they're not as many as you think. Another misconception is it's gonna be super painful.
Oh! I thought you said acupuncture would make me feel better. Trust me, it will.
Yes, you may feel the needle insertion, you may feel a little prick. Sometimes people don't feel anything, sometimes they feel a little something. You may feel the muscle vacillate, a little twitch. Sometimes you feel a little shock go down and then it dissipates. And those are all fine. But what you won't feel is the insertion of a hypodermic needle. Hypodermic needles are designed to create a hole in the body so liquids can go in and out. The needles we use are filiform, meaning there's no hole. You can put 5 needles inside the hole of that. So they're really tiny, you can barely see them. And they're really flexible, but you can tie them in a knot. They're like little thin hair-like things. Another misconception is we reuse the needles. No, we do not. Zero. Once the needle is touched to human skin, it gets thrown in the red sharps container. The red sharps containers, we put it in a bigger sharps container. We take that down to the UPS dock. They take it, burn it in an incinerator. One of the things about the needles is they're all sterilized and they all have an expiration date on them. And that's usually due to the glue on the packaging because we want to make sure that no air gets in there. That's about it.